This is Bianca LoVerde presenting Pediatric Resident Education and Patient Outcomes in the NICU. At UPMC, our pediatric residents complete only 2 months in the Neonatal Intensive Care Unit, or NICU, over their 3 years of residency, a significant decrease from previous pediatricians. At the same time, there have been clinical advances and a surge of non-physician providers that have decreased the numbers of invasive procedures that residents undertake. All of these things have contributed to a decrease in resident satisfaction on their NICU rotations. My objective was to determine if a resident-only rounding team increases educational satisfaction, improves resident knowledge, increases procedure attempts, and improves patient quality outcomes. To do this, I created a resident-only rounding team at McGee Women's NICU under the supervision of a neonatologist. There were several curricular interventions that I implemented for the residents, the materials of which you can see to the right. To measure these changes, I evaluated resident rotation evaluations, procedure logs, in-training exam scores, and patient outcome data. What I found was that on the evaluations, positive comments outnumbered negative or neutral comments 3-to-1 as compared to a ratio of 1-to-1 for the control group. Qualitative analysis of these comments is still pending. The first table that you can see shows that residents report an increased satisfaction with their level of autonomy and educational learning experience on their NICU rotation after the curriculum was implemented. The second table shows the infant characteristics based on team composition. Overall, the infant's characteristics are similar in both size, age, and length of stay, as well as ICD-10 codes that are a surrogate for acuity before and after the intervention, as well as between the resident and non-physician provider teams. My preliminary conclusions are that a resident-only rounding team in a Level 3 NICU is feasible and improves resident satisfaction with the learning experience and autonomy. Thus far, infant outcomes appear to be similar but require statistical analysis, but no safety concerns were raised. This seems like a viable way to increase resident exposure and satisfaction on a NICU rotation without compromising patient outcomes. In the future, I'd like to complete the qualitative analysis of the comment sections as well as the procedural data and patient outcome data statistical analysis. I'd also like to track UPMC resident applications to neonatology fellowship as a gauge to continued interest for pediatric residents in the field of neonatology.